I'd like to introduce our next speaker, Dr. Sophia Wang with the IU School of Medicine. And she is here to really help us to wrap up the total of our last 2 days. No pressure, Dr. Wang, no. In really culminating to a conversation around Alzheimer's, where we look at the systems of how public policy is supporting or not the move forward of resources, workforce, grants, funding, and community collaborations towards a disease state, and to ensure that equitable access is provided for those that are most vulnerable and for those that are most under-resourced. Alzheimer's, with innovations in drug therapies, with innovations and interventions and more funding, is a great area where equity truly is being optimized, and the processes, the procedures are really being looked at to support how can we collaborate. So we're going to welcome Dr. Sophia Wang to the podium to talk about her research and work and how you can get involved in the work that they're creating today. Dr. Wang.
Can everyone hear me? All right, great. Well, thank you so much for having me. And I think before we get started, I think I just want to get a sense of how familiar everyone is with Alzheimer's disease. How many of you have had someone that you know or love affected by Alzheimer's disease or significant progressive memory problems? Raise your hand. Okay, so I see some numbers. Here, good. And how many of you know someone that's had an infection with COVID and still having some sort of significant memory symptoms, their brain feeling foggy? How many people know someone like that? Okay, so equally as number. So that is really what the heart of our conversation is today. If you could just advance to the next slide. I have no disclosures, funded by the federal government. Do you want to go ahead? So that's really the heart of our talk today, is the pandemic's not over, but another pandemic has actually begun, and that is the pandemic of long COVID. And today we're going to start to lay the groundwork on what we want to do to collaborate with community partners like you, because we're actually not in the community the way we should be. We're a federally funded grant there, research, scientists, clinicians, myself. We need to collaborate, and that's where the conversation begins. So as many of you know, starting in the year at the end of 2019, they discovered the COVID-19 virus began in Wuhan, China, and then quickly spread. As all of you know, the transmission rate was so high that within New York, within a couple of months, out in New York City, so this is Central Park, it's actually near where I trained at Mount Sinai, they actually had these morgue trucks put out because that was the rate of both lethality and transmissibility of the virus. And as we know, there was a huge national shutdown for some period of time. Next slide. And what we saw, not shockingly, but very saddening for all of us, is that the COVID-19 pandemic really affected those who were least able to get care. We saw higher rates of cases, hospitalization, and death across multiple minorities, including American Indians and Native Americans, Black and African Americans, and Hispanic and Latinos. Now, some of this was due to the fact, or a lot of it was due to the fact that if you were a minority person, you were much more likely to be a frontline worker, not able, right, to sit on Zoom safely in your home. But I think one of the things worth noting is that it was also due to underlying medical comorbidities. But there were growing epidemiologic evidence, even after they controlled for all those factors, that African Americans and Blacks were still more likely to have higher rates of hospitalization and death. I'm going to just ask you to note that for a moment because it's going to become relevant as we continue our discussion. Next slide. And one of the other really important aspects that people began to notice was that after infection with the COVID-19 virus, it wasn't just like, frankly, having a regular cold. There started to be symptoms that were very unusual called long COVID. And people who were perfectly healthy, in fact, this was first noted amongst healthcare professionals. So people who were highly functioning at baseline who got this virus, even when it was quite mild, started to have unusually prolonged respiratory symptoms, fatigue, and brain fog. Next slide. And by the time, and a couple of years later, about 20% of our population of adults were affected with essentially multiple symptoms across multiple organs. not only just affecting the brain, but also the heart, kidney, lungs, musculoskeletal conditions, and probably most concerningly and unexplainably, this virus caused blood clots. And that in itself is a risk of high mortality. Next slide. So where do we stand now? This is a recent survey that was done by the Kaiser Foundation. And what we really saw was consistently, again, disparities in many different ways of how long COVID affects us, and why I hope this is an important question for all of us to work together on. People who are transgender were at higher risk for COVID. People who were Hispanics were much more likely to get it, and people with lower education. The statistics are a little bit interesting. Even though people with higher age were less likely to report symptoms, I think that objective data shows that at least older adults are at higher risk for more serious long COVID symptoms. Next slide. All right, so what are the problems now? This won't come as a shock to you, but if somebody is a person of color, they're less likely to get better care for long COVID. Next slide. And why is that? Well, first of all, as you saw, COVID hits multiple organ systems. And when a disease like that happens, you often need subspecialty care. Who are the people least likely to get that subspecialty care? Once again, underrepresented, communities. Less awareness of the disease, right? You're going to be less likely to advocate for yourself, or less likely to have people to advocate for you to get that subspecialty care if you don't even know what long COVID is. And then finally, we are still not understanding a lot of these symptoms. We don't understand the management and treatments. And so a lot of healthcare professionals who don't know much about this will often dismiss their symptoms as sort of in your head, psychiatric, stress, etc. I think there are two things worth noting. Even though Hispanics are much more likely to have symptoms, probably in African Americans and Blacks, they appear to have less utilization of care. So that means there's definitely a significant access issue in terms of African Americans and Blacks getting outpatient rehabilitation and services for that, for this very highly complex syndrome. Okay. So one of the things I emphasize, and this is why we are here today to work with you, I saw one of the key initiatives was COVID-19 research. Research is going to be crucial to solving the last problem. It's not going to be the entire solution, but it's certainly the beginning of the solution, right? We need to get diagnostic tests. We need to figure out how to treat these people. And NIH has laid out 5 key priorities to solving this, including raising the fundamental knowledge, advancing research to improve detection, supporting research to advance treatment, and accelerating research to improve prevention. And I think the 5th one will be of the greatest interest to you, and that is to prevent and redress poor COVID outcomes, particularly in communities of color. Next slide. So there's a number of objectives. You can actually check this out online. I can get you the URL if you don't want. But the 2 that is of highest interest to our center, the Indiana Alzheimer's Disease Research Center, you'll probably wonder what's the relationship between the 2, I'll get to them in a moment, is number 1, we want to understand and address COVID-19 as it relates to health disparities in populations. Number 2, we do think that older people are at higher risk for the long-term sequelae of COVID-19, particularly memory problems. Next slide. Okay, so brain fog. I'm sure all of you know somebody, as you just raised your hands, somebody with brain fog after they've had a COVID infection. Did you have a question? Oh, okay. Feel free to interrupt me. Questions are welcome, or questions at the end are welcome. Even people with mild cases are developing brain fog, even if they don't go to the hospital, and sometimes they don't even realize they had a COVID infection unless they tested positive, right, because they got exposed, and then later on they start to get strange symptoms. So moving on. Next slide. So what do we need to do to begin to understand the questions of long COVID? 3 things. First of all, the disease comes in different levels of severity. Second of all, we need to understand the effects of someone's medical condition that they had before the COVID infection. And finally, we need to understand the wide range of neurologic and cognitive symptoms. By the way, Sunny can make these slides available to you. These are federal government, so if you want to copy the slides, we can get them to you. Moving on. All right, so question number 1. What is the relationship between COVID-19 and dementia? So again, as a friendly reminder, as all of you know, Alzheimer's disease is the most common type of dementia, but what's the relationship between the 2? Next slide. So the data are very clear. If somebody had dementia before they had COVID, several things. First of all, they were much more likely to get a more severe form of COVID. They were more likely to be hospitalized. They were more likely to die from COVID. But the other more serious thing, and this is still not well understood, you're starting to notice a theme here, African American and Black patients were much more likely to have poorer clinical outcomes. And again, this is after we control for other medical conditions, other access to healthcare. So again, we're going to talk about why that might be. Next slide. Okay, so the other group of people, right? Perfectly healthy 20, 30-year-old. They got COVID, right? They have these kind of brain fogs. Does that lead to Alzheimer's? We don't know yet, but that's an important question that our center is trying to answer. Next slide. Okay, and then the other group, and this is what our center particularly focuses on, is people who didn't have Alzheimer's or dementia before the COVID infection, but they were at high risk for developing dementia. What do I mean by that? First of all, they are either older, women are at high risk, Blacks and Hispanics are much more likely to develop Alzheimer's and dementia compared to non-Hispanic whites, and vascular risk factors. So that is, they already had damage in their brain. As you can see, there's some white splotches there on that diagram. That's brain damage from high blood pressure and diabetes that have not been optimally managed, okay? They may not have had dementia at the time, but their brain already took a few hits before. And then they got COVID-19, and then the question is, are those people going to develop Alzheimer's or dementia? Next slide. All right, so the other big thing that matters is how severe is their disease. So without going into too much detail, because we have a limited amount of time, people who were more likely to, say, for example, end up in the ICU because they got really confused while they were having their COVID infection. They had a massive stroke. They had oxygen reduced, right? Hypoxia. All those things hit them. And then the other key question that we don't know yet is when people are in the ICU, sometimes they need drugs, they need ventilation to help keep them alive. They survive, but what's the effect on their brain long term? Do those people go on to get Alzheimer's dementia? Next slide. So what did the data suggest? Brain fog is a common problem. About 81% of people who have persistent symptoms said they had problems with their memory, they had problems paying attention, they had problems organizing complex information. Next slide. And the other really key thing is that there was a really huge study out of the UK, and these were people who actually had neuroimaging before they had COVID, but then they imaged them after they had COVID. That's worth noting because it's going to be really hard to do that pre-post comparison. But what they saw was this very subtle shrinkage. But if they were just to go into the doctor and to get a neuroimaging study, their doctor would say, oh, it's normal. So that is the thing. There is no comparison, but they were starting to see with these studies, these neuroimaging studies, there's a very subtle decrease. And it's not yet clear whether that's going to be progressive or reversible, but that is the key question that needs to be answered. So we do know that even in the mild stage, COVID does cause some kind of damage to the brain, but it may not be something that's normally detectable when people see their doctors. Next. All right, so other big question. We didn't see this too much with Omicron, but with the earlier variants, Alpha and Delta, people often lost their sense of smell. Sometimes that was the only symptom from COVID. Another big question is, what's the long-term effects of that symptom? Next slide. So depicted down in the bottom, and I know there's a lot of arrows and everything, but if you look, there's these small blobs. What we see in certain people who continue to have that persistent loss of smell, I'm sure you all know someone who's lost their sense of smell after having had COVID, right? But most people got better, but some people didn't. There's a subset of people, and we can see it on these electron microscope pictures, that the virus still sticks around. In other words, there's something unusual about those people, that their body can't get rid of the virus like it would with other people. And that appears in those people to be causing that long-term loss of sense of smell. Next slide. And why is this of interest to Alzheimer's research? So before COVID ever came around, people started looking at whether loss of sense of smell was associated with Alzheimer's. And the reason for that is because loss of sense of smell is tied to your olfactory nerve. And your olfactory nerve gives us a window into how your brain operates. And so now the big question is, if somebody lost their sense of smell from COVID, are they going to get Alzheimer's? Next slide. Well, that's a great question, and we're going to move on to the next slide. the jury's out. There's some suggestion that this may indeed be the case, that at least in older adults who lose their sense of smell from COVID may be at higher risk for Alzheimer's, but this is one of the reasons we need to partner with the community to begin to study this key question. Because it appears that the virus is still sitting in them, damaging their olfactory nerve. It's probably damaging their brain, but we need to better understand it so we can figure out the next steps to treat it. Next. All right, so now moving along to the next slide. If somebody's sicker, what happens when they get COVID? So, as we saw earlier, people of color were much more likely to end up in the intensive care unit from COVID. What are the effects of that? Next slide. And the data are pretty clear. Anyone who got sick with COVID was 33.6% times more likely to develop either a neurologic or psychiatric disorder. This was done with an electronic health record. So there's something very specific about this virus. It's not just a respiratory virus. There's something very unusual about this virus that attacks the brain. Next slide. And what we really see, and I don't want to go into too much detail, is that we have sort of red boxes, but what you can essentially see in the bottom box where it says dementia is that if somebody got COVID, they were 2 times much more likely to develop dementia compared to getting a neurorespiratory virus. Really underscoring the fact that there's something very dangerous about COVID for the brain. Next slide. And moreover, if they were hospitalized in the ICU, and so if you look farthest to the right, they were 4 times more likely to get dementia. So how sick somebody got with COVID really correlates with whether they end up having long-term brain damage. Next slide. Okay, so we've kind of, I think, answered that key question of severity of illness being correlated with Alzheimer's. Next slide. And what still is not yet fully understood is if somebody went to the ICU, so these are a lot of these people who have survived, again, people of color, some of them might be younger, people in their 30s and 40s who for the first time got to the ICU. We don't know what the long-term effects of some of those treatments are. And those treatments were life-saving, okay, just to be clear, those were necessary, but what are the long-term cognitive effects? We really need to start to understand that, and that's a key question that has to be answered. So, all right. So I don't want to get tied up too much, but as most of you recall, I mentioned a few times there seems to be something that makes the African American and Black communities more likely to have poor outcomes with COVID. And this slide, if you kind of look, you see some sort of clumps of these red blood cells. It's because it's a clotting disorder. There's something about COVID that causes these clots to form in not only just in the brain, but throughout the entire organs. And we don't understand the mechanisms, but it appears that African Americans and Blacks are much more likely to develop these clots. And maybe it's related to high blood pressure and diabetes, but we don't think it's just that. There may be something genetic, and this is a really key question that we have to understand, especially if we want to find treatments for long COVID. Next slide. And so here where those red arrows are pointing, this is a brain of a patient with COVID. We can actually see that damage on the very high resolution MRI. So it's very subtle, you won't see it in like a regular brain MRI scan. If you go to a regular doctor, it's 1.5. This is actually somebody who died from it, that's an 11T. So basically about 10 times more powerful magnet. These are very subtle but important changes that may begin to help us understand brain damage from people who've survived COVID. All right, next slide. So where are we now? Let's just sort of get to the point. COVID, whenever it goes away, it will go away. But the impact of COVID on communities of color is going to be here for many years, and by years I mean decades to come. And so what are we doing to begin to solve these problems? Next slide. So we are engaging in research to help communities of color as well as others who are affected. For example, people who've been in ICU, so we have funded research for that. And then the other, next slide. And then the other, we're actually also part of a national initiative to try to understand people with mild and moderate, so less severe forms of COVID, and how that causes Alzheimer's. Next slide. Okay, so I know this is, the pandemic has really had a profound effect on all of us. I think that's, the long-term impact of long COVID on the brain is certainly one that is very fearful, I think, for many of us as we start to see patients who are finally coming back into clinic, they have these unexplained symptoms. But I think the bottom line is the only way that we can begin to figure this out is to do research. And that means people like me, doctors like myself, who want to help patients. We need to collaborate with community partners like you to be able to earn the trust of these communities in order to be able to do research to help everybody. Next slide. And so we really want to encourage you and your organizations to work with us, okay? The good news is that I saw all these people about how to write a grant. I am so impressed. The good news is that you don't actually need to write a grant. We have our own grants team. We'll write the grants. You don't ever have to sit in front of a computer and say, ooh, like I clicked on the wrong button. We have people to take care of it. We've got a huge admin team. We've got great staff, Alan and Caprice. We have a huge, actually, center of about a couple hundred employees. So what do we need? We need you. We need you to come, join, and talk to us. Talk to us about where communities are experiencing in terms of COVID, and work with us to help us align with the people that you're seeing to figure out how to get them into that research. That's what we need. We take care of the grant writing. What we need are people like you who understand communities, who understand people. That's what we need. Next slide. So please join us in the back. You can get my email as well, but you can also, about broader questions about Alzheimer's disease, not just COVID, please feel free to contact us. We're funded by your federal grants. We give free talks in the community to healthcare professionals, to any organization, about any topic that you want about Alzheimer's disease. And I know there's been a lot of information about the latest Alzheimer's disease drugs that are awaiting FDA approval, and so we're happy to come talk about that too. So please come talk to us. You've already paid for our services. It's your federal taxpayer dollar. We're here to help, support, and work with you. Thank you so much, and I'm happy to take any questions.
Who else has lost their sense of smell and not scared to death? We are going to be watching your studies.
Well, we definitely need folks to join. So if you want to start working with us, we're right here. Thank you so much. Feel free to come ask any questions privately in the back, because I know it can be awkward to talk in front of a whole audience. Thank you so much.
You signed up right here.
Oh, okay. All right, thank you so much.
Thank you.